Good afternoon, everyone, and thank you so much for joining our lightning session this afternoon. My name is Shondell Wilson Frederick, and I serve as the Chief Engagement Officer of the National Heart, Lung, and Blood Institute at NIH. Today, I have the pleasure of moderating today's session. We have a total of 8 presentations, and each speaker will have 7 minutes to present. To ask a question, feel free at any time to add your question in the Q&A tab. Questions will be held until the end of all presentations. All sessions will be recorded. Recordings and presentation materials will be shared publicly via the ACS online community after today's conference. Well, that's enough of the housekeeping orders from me. You didn't come to hear me speak. You came to hear our wonderful presenters. So let's go ahead and get started with with Jill Janaga Bredman, an economist with the U.S. Bureau of Labor Statistics.
Thank you. Here we go. Okay. So thank you for having me. I'm Jill Janica Rudman, and I'm going to talk to you today about some continuing research my co-author and I are doing on private business remote work and productivity growth. Of course, the usual disclaimer applies that the views expressed here are my own and do not necessarily reflect the U.S. Bureau of Labor Statistics. Before I get into the results, just a quick overview of the 2 different ways that BLS measures productivity. The first is labor productivity, and what you probably hear about in the news, as it's a quarterly measure and one of our principal federal economic indicators. It's measured by output per hours worked. So the only input here is hours worked, which means labor productivity growth. The source of it can be a variety of things, such as use of capital, the labor composition of the workforce, and innovation like technological advances and organizational process changes like remote work. The second way we measure productivity is called total factor productivity. I'll probably refer to it as TFP, and it's output per a combination of inputs, where those inputs include capital, labor, including the labor composition, energy, materials, and purchase services. So this means that the sources of growth for TFP are more focused on that innovation piece of automation and the change in organizational processes like remote work. So we think is a better proxy for our research. Now, of course, there's been a lot of research about this topic. Most of them do focus on labor productivity and don't find a relationship between the two. But as you just saw, their only input for labor productivity is hours worked. A lot of the other research focuses on aggregate levels of the economy and industry sectors. And then there's a third body that's about individual companies where they proxy productivity using emails sent or phone calls made, and then also specific worker productivity that look at time use data where they find what you would expect, that commute time is less, sleep time is more, so work-life balance is better, and it can lead to enhanced employee performance. So we focus on total factor productivity and a more detailed industry level. And we use the American Community Survey question on how did this person usually get to work last week? And if they answered they worked from home, then we code them as a remote worker. We realize that this might capture some hybrid work, but in general, we think is a decent proxy for it. So to give you a descriptive statistic, it's not the 61 industries, that's a bit rough, but even the 21 is hard to look at sometimes. But you can see the general trend here all the way to the right is 2019 pre-pandemic levels. And you can see by 2021, all the way to the left, and then all the way to the right in 2021, you can see how much remote work had increased. And then you can see the slow decline in 2022 and 2023 data is in the red triangle there. But you can see that during this time period, in general, we've still increased remote work by 9.9% during this time period. It's also worth noting that the BLS started asking this question in their current population survey in October 2022. And so we wanted to see how that compared to the ACS, which is what we're using for our analysis. So ACS is here in red, and we would expect those that answer they're primarily working from home to also be the 50% or more in the CPS, so the dark blue bar here. And you can see in general, they're pretty much in line Those industries that are near the top there is a bit more in the CPS. And you can also see the light blue bar is kind of the hybrid workers in CPS as well. So some results. We do find that remote work is positively correlated with labor productivity and statistically significant. So this is different than a lot of the research that's out there. The way that you would read this graph is that a 1 percentage point increase in remote workers is associated with a 0.09% increase in labor productivity. And then each of these bubbles represents the 61 industries. The size of the bubble represents the percent share in 2019 output. Now, I said we were going to focus on TFP. So here's the same with total factor productivity, where we also find positive correlation. This particular run is not statistically significant. However, if you take out what we consider an outlier in this bottom right, the insurance carriers and related activities, it does become significant and also a stronger association. I also ran this with the CPS data instead of ACS with the insurance carriers back in, and it is statistically significant in that case as well. And we did see that CPS had a little bit more remote workers in their data set. So looking at the pieces of total factor productivity, we focused on 12 detailed industries with the largest increases in remote work. 10 of those 12 were able to increase their output without increasing labor by the same percentage. Then we delved into some unit costs to see how the industry fared, and we found that a 1 percentage point increase in remote workers is associated with a 0.13% decline in unit labor costs, so the industry saving there. And then we have a lot of capital asset detail data, and so the one that I pulled out for this presentation is office building costs, because obviously we'd expect them to need less office buildings if we have more remote workers. This is also a significant association. And like I said, TFP measures a bunch of other inputs also have these negative correlations. We then looked into how do the workers fare in real hourly compensation. There's no relationship. This is consistent with other literature that looks at what we call the productivity and wage gap, where efficiency gains or productivity growth is not associated with the same kind of hourly compensation for the workers' growth. And but we know that maybe workers are gaining in other ways, such as less commute time. So in conclusion, we do find a positive relationship between the percentage point change in remote work and productivity. We find unit labor and non-labor costs decline with percentage point increases in remote work, and that these gains are not passed on to the workers, at least in terms of real hourly compensation. So thank you, and here's our contact information. I've also, I think, put a handout in the side there that links you to our paper and other research, and you can get to the productivity homepage from there as well.
Thanks, Jill, for your presentation. Next, we will have a presentation by Lindsay Elliott with CORI.
Hi, everyone. Give me just one moment. Hi, everyone. My name is Lindsay Elliott, and I'm a data scientist for the Center on Rural Innovation. I'm very excited to be here, and today we are so excited to speak with you about a recent research that we've continued to develop that speaks not just to the United States as a whole, but specifically orients toward micropolitan and rural communities across the nation. Now, if the namesake didn't give it away, the Center on Rural Innovation is extremely committed to supporting rural communities. And specifically, our goal is to produce, develop, maintain, and distribute publicly available data on rural areas. And to that end, we want to advance rural economic prosperity. Because at the end of the day, we think that rural communities deserve to experience the same thriving economic landscape as our metropolitan counterparts. And today specifically, I would like to talk to you about quality of life. And quality of life specifically, excuse me really quickly, my apologies. And quality of life specifically orients to the ideas of why we wish to live and work in a certain community. And this is really important because the concept of quality of life goes far beyond the community assets of traditional economic measures, and instead starts examining the cultural and amenity values in a particular area. And importantly, it doesn't detract from, but it actually complements our economic outlooks, as we'll show momentarily. But despite this, econometric literature rarely considers quality of life. And we believe that this is important to bolster, but as well, as we all know as data scientists, this supplements the data that is already sparse within relation to rural communities across the United States. But specifically on the conversation of quality of life, there's a virtuous cycle that occurs where individuals who choose to live in areas with higher levels of amenity also create an organic natural market wherein we then can decipher and reveal preferences for locations and for those amenities. And so, for instance, in areas that have higher levels of quality of life, we may see that individuals are more willing to pay higher housing prices, or that they're even willing to forego higher wages to live in areas with higher quality of life. And this is very important to rural communities specifically, but unfortunately, quality of life has only recently been able to get into this discussion. And that is specifically because the original method, going back decades, included only individual level data or micro level data. Because of this, there was an oversaturation of metropolitan responses, and it ultimately failed to include rural, where research and literature said that rural communities likely just look like metropolitan communities on a smaller level, and we know that's not true. But more importantly, this also masked rural communities from policymakers and key stakeholders, and rural communities got left behind in the discussion on where to invest resources. And importantly, for our updates, we made sure that rural was front and center, and we did so by doing a couple of updates to the measure. First, we brought it to the county level, where then we were able to utilize the NHGIS and the American Community Survey where available. And instead of looking at individual level data, we were able then to look at contextual level characteristics of the county. This allows us to do a couple of things. First and foremost, it allows us to estimate quality of life for all counties instead of just metropolitan areas, and allows us to do it over time, which means now that rural areas can examine themselves over time, or rural areas can compare themselves against other rural communities or metropolitan counterparts. And so, for instance, instead of examining individual level characteristics, like asking an individual of their income or how much their home value is worth, we can look at county level characteristics, which gives us a much more nuanced approach. And on the topic of methodology, previous research has brought this discussion to the county level. But unfortunately, it was only a general amenity value that essentially asked whether or not an individual, whether or not median household income was a product of median home values. And instead, we decided to include county characteristics for quality of life that in turn allows us to distinctly and accurately and thickly describe communities across the United States, and specifically rural communities. It also allows us for greater prediction of quality of life, which then in turns allow us a more nuanced approach to examining rural communities. And you might be asking, well, why does quality of life fit into the discussion of econometrics? Well, what we can tell you is from our own research is that it certainly does. And in fact, in recent research, we have found that quality of life is a key leading indicator for population growth and employment growth. And in recent research that I myself have conducted along with the research team at the Center on Rural Innovation, we found that quality of life is a key leading indicator toward entrepreneurial activity, such as business establishment and development, and as well, self-employment. And this is especially true for rural communities. And it makes sense. Rural communities, on average, usually have greater levels of natural amenities and higher culture downtowns rather than metropolitan communities, and therefore they have the niche to be able to increase quality of life while simultaneously bolstering their economic outlook. And so allow me quickly to wrap up and we'll go to a conclusion. First and foremost, as far as a key takeaway is concerned, our new update of quality of life allows us to estimate it across time and within rural communities. This is very important because it allows us to have a much more generalizable outlook of quality of life among the United States and allows us to look at the United States economy in covariation with living standards. This is particularly important for salient for rural areas because previously they have been masked from this discussion. And most importantly, it puts rural back into the discussion, not just within literature and research, but specifically in policymakers and key stakeholders, where now rural community may get a fair share and we can start investing resources toward these critical areas. Thank you so much for your time today. And if you found quality of life interesting or just want to see what the Center on Rural Innovation is up to, take a look at our website at ruralinnovation.us. Thank you, everyone.
Thank you, Lindsay. So our third presenter this afternoon is Ilham Derry, and Ilham is a senior research associate at the Urban Institute.
Thank you so much. I'm very excited to be here. So today I'm going to discuss the findings from our new measure, the true cost of economic security. So I'll walk through the development of this measure and how we use it to analyze how many families don't have sufficient resources to attain financial security. So what is a true cost of economic security measure, and what can it help us understand about the circumstances of families? So there's a large group of people who aren't experiencing poverty, but they still feel like they are struggling financially. And even among families that can meet most of their basic expenses, we know that many of them are still not set up to weather unexpected costs like a healthcare bill or a car repair. So a TCAS measure can hopefully help us understand exactly what it takes for a family to be economically secure and financially resilient, and help us assess why families fall below the TCAS level and whether those reasons vary by place. So a TCAS measure should be able to account for all of a family's expenses. So that includes things like housing, childcare, but also those that are often overlooked, like paying off debt or saving for retirement. And it should be able to capture all of a family's resources that are available to them. So not just their earnings, but retirement withdrawals and assistance from public programs. And then hopefully once we better understand this group and why families fall below the TCAS, the measure can help us identify policies that will help us support economically insecure families. So what are our top line findings? We found that 52% of people and families in the US did not have the resources to meet the true cost of economic security. And of those people, about 9% could meet all of their expenses, but they were just unable to save for the future. And we also see that TCES rates are higher for families with children. So about 3/5 of children and families did not have the resources to thrive. But first, we'll get into a little bit how we developed this measure. So in order to create the TCES, we needed to understand families' total costs and their total resources. Sorry, slides are... Okay, now I think you can see the right slide. So on the cost side, we use publicly available cost data from various sources to develop the TCAS thresholds. And those thresholds represent the cost that the total expenses that families have, and they vary by location and family type. And then on the resource side, we pair that with data from the American Community Survey, which provides information on family characteristics and many types of income. So we use ACS data for 2018 and make adjustments to reflect 2022 circumstances. And then the ACS data is enhanced using Urban's ADIS microsimulation model. So that's the analysis of transfers, taxes, and income security model. And that allows us to adjust for the underreporting of certain resources, like safety net receipt or tax credits and other sources of income. And then finally, once we know families' costs and resources, we're able to compute their true cost of economic security rates by location by assessing whether each family's costs, each family's total resources can meet their expenses. So we use a variety of sources to determine what it would take for families to obtain adequate housing, food, healthcare, which includes premiums and out-of-pocket expenses, childcare, transportation, technology, which includes having a phone as well as broadband, the taxes they owe, student debt payments, miscellaneous expenses like personal care, as well as a savings target. We set a savings target of 10% of a family's total costs. And then on the resource side, we are able to factor in things like earned income, other types of income like pensions and distributions from retirement, as well as the value of benefits that families receive from social assistance programs like TANF, SNAP, and housing vouchers. And as I mentioned before, for these programs, we correct for under or non-reported benefits by aligning receipt to administrative data. And then we're also able to offset health insurance expenses for individuals who report employer or government provided health care, and offset childcare expenses for people with an available adult at home to provide care. So now that we've walked through the methods, these next few slides are going to take a look at some of the results. So we find that costs, resources, and true cost of economic security rates vary across family types. And this first slide shows the TCES rate, median costs, and median resources for families with children and no older adults. So that first colorful bar represents the median costs for families with children. And the median family with children has housing costs of about $18,000 a year. That's the green bar. $20,000 in healthcare, $12,000 in food, and so on. So total median costs for a family with children is about $134,000 compared to their median resources of $121,000. And then on the far right, we show the TCES rate for this group. So 58% of people in families with children and no older adults do not have the resources to meet the true cost of economic security. So that's a slightly higher share than that national average we discussed earlier. Here, this graph compares TCES rates across people of different ages. So children, working age adults, and older adults. And we see that children are most likely to be economically insecure. So 61% of children live in families that don't have the resources to attain economic security. And TCES rates are lower for other groups, but still show that about half can't meet the TCES thresholds. And then finally, we wanted to better understand factors that are contributing to families falling below the TCES threshold. So to do that, we focus on counties with the lowest and the highest TCES rates. So a high rate indicates that a greater share of people don't have the resources to thrive. So the two bars on the left are median costs and resources for high TCES rate places, and the bars on the right are for low TCES rate places. If we first focus only on the cost bars, so those are the ones with the yellow arrows, we see that costs are about the same in high and low TCES rate counties. Median resources, however, which are those blue bars, differ considerably. So high TCES rate counties, so those are the ones that are worse off, have substantially lower median resources, even though there are about similar costs between the high and low TCES rate counties. So this indicates that the differences in TCES rates might be driven by differences in resources rather than differences in costs. And then finally, just some takeaways to wrap up. So half of all people in the US are economically insecure, and families with children are particularly vulnerable. And places with higher proportions of people struggling do not have, it's not that they have higher costs, but the resources of residents are particularly low. And then I will just wrap up with acknowledgement of our funder as well as the broader urban team that supported this work. Thank you.
Thank you. So we'll have our next presentation by Martha Jones. Martha is an associate professor at Vanderbilt University.
So actually, hang on. For claims rates, the numerators is collected by state agencies, the illness and injury counts. But for the denominators, what's preferred is a full-time equivalent employee instead of just employee counts. This is because the number of claims per employee is a function not only of the hazard levels of work tasks, but also the number of hours that employees spend at work. Workers' comp data systems, however, do not typically include the number of employees or full-time equivalents, so we must look to other sources. What's the best way to obtain full-time equivalent denominators on the industry level? Well, the Quarterly Census of Employment and Wages, QCEW, provides authoritative employee count data based on a census of employers, but it does not provide hours of work data. So how to estimate full-time equivalents? Our method is to multiply the employee count from the QCEW by an adjustment factor that we obtain from a survey, such as the ACS or from the BLS Office of Productivity and Technology. QCEW employee count data are published on the industry level by the BLS and can be obtained on the employer level from state workforce agencies with an MOU. The adjustment factor, full-time equivalents per employee, is calculated on the industry level using FTE and employee data from, again, a national or state survey. So this slide quickly compares some aspects of the ACS data with the OPT data. The OPT data are very straightforward to use. They are national data collected using NAICS codes with employer-based surveys. So the industry coding is quite accurate in this data set. Detailed industry data are available at both the 3- and 4-digit level. ACS data, on the other hand, are more complicated to use. They are collected by the Census Bureau using census industry codes, which need to be mapped onto NAICS codes. As the ACS is a household survey, it has a lower accuracy with respect to industry coding than employer-based surveys. ACS data can have significant sampling error and are available for most 3-digit industries, but only some 4-digit industries. And finally, there's imperfect alignment between the industry last week and the questions about hours worked that refer to the previous 12 months. So why would we use ACS data? Well, we found that states strongly prefer to use the data collected for their own state, and also sub-state data are available from the ACS. But states prefer ACS data, but how do state level data compare statistically to national level data? We investigated how much of the variation among state level FTE per EE estimates based on ACS data is due to real differences in FTE per EE as opposed to imprecision in estimates. To do this, we computed FTE per EE estimates and standard errors for all available ACS state industry combinations at the 3-digit NAICS level. And as you can see in the figure on the right, the x-axis shows that these FTE per EE estimates were then grouped into quintiles based on their standard error. The y-axis shows the percent of state-level FTE per estimates with statistically significant percentage difference from the national FTE per EE. In summary, even estimates with relatively high standard errors, in group 5 there, often provide statistically significant evidence of difference from the national average. So bottom line, in most cases, using the state-level ACS data is a good idea. In this slide, we consider the misalignment between ACS questions for industry and hours worked. ACS respondents are asked about the industry of their current or most recent job, their primary job, and also about usual weekly hours and weeks worked. They're asked for all jobs held during the previous year, even though multiple jobs might be in different industries. So to estimate full-time equivalents on the basis of hours worked per week, we simply, for the individual respondent, divide usual weekly hours by 40 hours. This does result in an upward bias in the full-time equivalent estimate. Again, the hours worked, usual weekly hours are for all jobs in the last 12 months, but workers are only classified to the industry of their current primary job. And also second jobs or third jobs generally have fewer hours, but are not included. So next question, do differences in data source and method for estimating FTE per EE have a significant impact on claim rates? As claim rates is what we're interested in ultimately. And the ranking of industries by claim rate, because again, we're thinking about prevention and looking at industries with high claim rates. If variation among industries in the claim rate is large enough, a limited amount of error in the denominators might have little impact on industry rate ranking. And we use data for Washington State for this section. And this issue is examined for FTE per EE estimates using both ACS and OPT data. And our calculations show that these various sets of denominator estimates produce similar results in terms of ranking the 10 industries with the highest claim rates. And here's my contact information. There are a few extra slides that include the report's table of contents, as well as more state-level detail for one industry, showing the estimates with relatively high standard errors often provide statistically significant evidence of difference from the average, national average. Here's an example of the table of contents. So thank you very much. I really appreciate your attention.
Thank you so much, Martha. And you finished in perfect amount of time. Great
Right.
presentation. All right. So our next presentation will be by Kellyvette Ortiz Fontanes. And Kellyvette is a survey statistician at the Census Bureau.
Thank you. Just 1 second. Okay, so good afternoon, everyone. I'm Kellyvette Ortiz. I work for the Center for Behavioral Science Methods here at the Census Bureau. And I want to acknowledge my co-authors, Ana Sanchez Rivera and Yasmin Garcia Trejo, also from the Census Bureau. So first things first, what is the low response score? The low response score, or LRS, is a measure developed by the Census Bureau to predict the percentage of people in a given census tract or block group that is likely to not self-respond to the decennial census. The latest version is based on an ordinary least squares regression of 25 predictors. Its values range from 0 to 100, with lower values meaning that a smaller proportion of the geography is likely to not self-respond. The LRS is published periodically in the Census Planning Database, and the planning database contains several population, household, housing unit, and operational measures from the ACS 5-year estimates and decennial census counts. So why is it important to develop an LRS model for Puerto Rico? The main reason is aiding the 2030 census operation on the island. And in preparation for this, the Census Bureau is revising the current national level LRS model and looking into developing models that are tailored to the individual states. But because the current LRS model excluded Puerto Rico from its design, it was not appropriate to include it as part of the general state-level modeling. Besides, ACS already collects data annually through the Puerto Rico Community Survey, which means we have all the information we need to develop this model. So through this study, we're trying to answer 2 main research questions. First, we wanted to know how accurately the current LRS model predicted low response census tracts on the island. And once we obtained those results, we wanted to explore what adjustments were needed to improve the prediction accuracy for Puerto Rico. To answer our research questions, we took 3 steps. First, we evaluated model performance by analyzing predictor coefficients, testing some correlations, comparing distributions between Puerto Rico and the United States, and examining model residuals. Second, we explore how to improve the model fit for Puerto Rico by testing the removal of some predictors and identifying new ones to include. And finally, we examined different model alternatives and selected the one with the best fit. So on the results, when running the current LRS model for Puerto Rico without any modifications, we obtain an R-square of 0.72. In addition to these, our mean square error is very low at 0.064. So overall, our model fit statistics look good for this initial model. Nonetheless, the results show that 14 out of the 25 predictors were statistically significant, which means 11 were not. The figures on this slide highlight 3 of these non-significant predictors. The percentage of Hispanic or Latino population wasn't significant, likely because over 98% of Puerto Ricans identify as Hispanic. Similarly, the percent of non-Hispanic white alone was insignificant, probably due to the small population share on the island. And lastly, while poverty levels show more variability in Puerto Rico, its high prevalence may limit its explanatory power. So based on our coefficient and descriptive analysis, we decided to remove 9 predictors from the model. Table 3 presents the result of our model without those 9 variables. All of the predictors for this reduced model are significant, except one of the age groups that we needed to keep to maintain the full range of the age variables. And as you can see on our model fit statistics, the 9 predictors do not seem to have a noticeable effect on our model fit. So our R-squared and mean square error remain virtually the same. And what these results tell us is that we might not need as much to reach the same level of explainability for our Puerto Rico base model. Finally, we tested new predictors to add to our model. We added 2 from the updated national model, the percent of households with only smartphones, and the percent of crowded occupied housing units, both from the ACS. In addition to, we added 3 ACS predictors that were adapted specifically for Puerto Rico. The percent of persons 5 years and over who speak English less than very well and speak Spanish at home, and the percent of households with no computing devices. And we also proposed replacing the poverty rate, which was not significant, with the public assistance income, also from the ACS. In the process, we removed 2 additional predictors, the percent of non-high school graduates and the population density due to their lack of significance on the final revised model. In terms of our model fit statistics, we obtained an R-square of 0.74 and a mean square error of 0.054. This is a slight increase in our explained variability compared to the reduced model. So in conclusion, we end up with a model with 19 total predictors, which is fewer than the baseline model, a slightly higher R-square, and with only predictors that are significant for Puerto Rico's context. To visualize some of those results, in these slides, we can see the residual absolute values represented on heat maps. The map on the left represents the baseline model residuals, and the map on the right, the revised model residuals. And while the differences are subtle, looking at table 10, we can see that the percentage of residuals on the lower bin from 0 to 5 increased by almost 2%, while the 5 to 10 and 10 to 15 bins decreased by 1%. So in conclusion, there is still a lot of room for improvement, and we have plans to keep working on improving the model fit and predictive power of our model. But through this study, we hope to have at least laid the groundwork to eventually make the low response score available for Puerto Rico. In terms of future research, we are considering several things. Some of them are to include geographical variables on the model, specifically metropolitan versus non-metropolitan area flags. We also want to explore the viability of including non-response follow-up operational statistics like contact attempts and mailings. And eventually, we want to identify predictor candidates that are currently not part of the planning database. For example, the vulnerability index that the Census Bureau produces. And finally, the broader LRS work group is already working on dynamic predictor selection, and we want to include Puerto Rico as part of that. Gracias.
Thank you, Kelly Vett. So next we'll hear from John Powers. John is a research data scientist at the University of North Carolina, Chapel Hill.
Good afternoon, everyone. So today I will be talking about comparing healthcare system patient populations to regional populations. And I want to begin by acknowledging the team that led this project, which includes personnel in the School of Medicine and Department of Sociology at UNC Chapel Hill, staff members from the Enhancing Health Data Program at the Census Bureau, and a clinician affiliated with UNC Health Alliance. This content does not represent the views of the US Census Bureau or the NIH, which funded this work. So, over the past couple decades, we've seen substantial growth in the number and size of large healthcare delivery systems. For the UNC healthcare system, for example, we can see here the distribution of its hospitals across North Carolina. And this healthcare system has numerous other affiliated practices across the state in addition to these hospitals. As these systems have shifted to electronic health records, this has led to data warehouses encompassing large populations of patients. And together, these factors have facilitated conceptualizing, providing, and researching healthcare at the level of populations. Considering healthcare at a population rather than individual level can raise many questions. Foremost, what population is being cared for? Do the patient populations of these large systems simply reflect the broader populations of the regions they're in? Or are residents more or less likely to be patients in these systems based on factors like race, ethnicity, or social determinants of health, SDOH? As part of a broader collaboration between UNC Chapel Hill and the Census Bureau investigating SDOH, we developed an approach to answering these questions at UNC Health, which can serve as a template for other healthcare systems. We leveraged two main sources of data for this work. First, electronic health record data from patients in the UNC healthcare system. UNC Health is a state-owned system, so North Carolina residents are the focus of its mission, and it cares for around 20% of the state's population. We used a patient data set from 2018 to 2022, which encompassed about 2.1 million patients. Our other main data source was the publicly available 2015 to 2019 ACS 5-year estimates, and we used these to estimate these estimates to obtain demographic data and to compute SDOH measures, both at the tract level. Turning to our results, when we compared overall distributions of race on the left of the dashed line and ethnicity on the right, we observed these distributions were very similar between the patient population and the state population. For SDOH, however, we observed some differences between the patient and state populations. Here I'm showing you results from one of the SDOH indices we looked at, the Area Deprivation Index, or ADI. The ADI is a measure of neighborhood socioeconomic disadvantage, with higher scores indicating greater disadvantage. It uses a weighted combination of 17 measures that can be obtained from ACS estimates. And I'm showing KDE plots here and on the next slides, which are very similar to histograms, except they model the data with a smooth function rather than discrete bins. We've normalized these plots such that the area under each curve is the same, which allows for visual comparisons of the group concentrations independent of group sizes. So looking at tracts based on their ADI scores on the x-axis, we see that the patient population is more concentrated in neighborhoods with the lowest and the highest disadvantage relative to the broader state population. This could be due to several factors in the case of this healthcare system, such as its program to provide essential care to patients who otherwise could not afford it. We then stratified those distributions by race. Because there are so many distributions now, I'm showing you all the distributions for the patient population in the left plot and the distributions for the state population in the right plot. There are a couple main things we took away here. First, there are striking differences between racial groups in the types of neighborhoods they're concentrated in. For example, Asian populations are concentrated in low deprivation neighborhoods, while American Indian populations are concentrated in high deprivation neighborhoods. But second, comparing the left and right plots, these patterns generally look quite similar between the patient and state populations. We also stratified by ethnicity and observed higher concentrations of Hispanic or Latino populations in high deprivation tracts. But again, this pattern was similar between the patient and state populations. In conclusion, in comparing the UNC Health patient population and the broader North Carolina population, we observed many similarities, but also some differences. We also noted substantial differences in SDOH between racial and ethnic groups. In terms of the larger aim of this work, we've demonstrated a low-cost, generalizable template that healthcare systems can use to characterize their patient populations with respect to general regional populations. And this approach can easily be extended to characterize more specific patient populations of interest. Using publicly available aerial data from the ACS makes this approach easily accessible to other healthcare systems. Although, just to note, for future work on this project, we'll also be leveraging ACS microdata to further investigate SDOH with UNC Health data. With that, thank you all very much for your attention.
Thank you, John, for your presentation. Next, we will hear from Brian Glassman. Brian is the Chief of the Poverty Statistics Branch at the U.S. Census Bureau.
Great, thank you. So I'm going to talk today a little bit about the inclusion of the incarcerated population and income and poverty estimates in the ACS. This is work written with two of my fantastic co-authors, Adrienne DiTommaso and Lizzie Peltier, all of us in the U.S. Census Bureau. So the incarcerated population is a small population. It's about 0.6% of the entire U.S. population. It's not often studied here, and we don't generally compute statistics for it, but we think that it is an important group to study and talk about, as we'll show in a second. So the data we're using is from 2019 and 2023. It comes from the internal one-year American Community Survey files, and I'll say in a second why we picked those years. Our focus is on the income and poverty status of the institutional GQ population that are currently incarcerated. So they are not included in our poverty or our household income universe. And we feel that this exclusion has the potential to limit the representativeness of our estimates of income and poverty, because we're excluding people that have low and possibly unstable resources. And this can be especially important for subgroups of the population that may be highly represented among the incarcerated population. So you may or may not be aware, but there was a change in data collection efforts at federal prison facilities during the pandemic. Prior to 2020, income and demographic data was collected by field representatives starting in 2020 and continuing to 2023, although no longer in 2024. Federal prisoner data was increasingly completed using administrative data. So basically, we had data on sex, age, race, ethnicity, and citizenship of the incarcerated person, and then we used that to impute all their other data, including income. So that's why we're going to look at 2019 data prior to that, prior to the pandemic, and 2023, just to see what that change did. So for instance, in 2023, 36% of the incarcerated sample had imputed income. But when we look at federal prisoners, it was 93%. In addition to imputed income, we also have some observations that are completely imputed or synthetic. Basically, there was an insufficient sample of our GQ population to produce estimates for smaller areas. So we began doing this full person imputation in 2011. And in 2023, 45% of the incarcerated sample was synthetic. This table, just to briefly give you a idea of the size. So about 1.85 million people were incarcerated in 2023. And you can see about 8.9% were in federal prisons, 58% state prisons, about 29% local jails, and then some small portions in correctional residential facilities and military jails. All right, for our methods, we're going to treat the incarcerated population as households of one for income and poverty measurement. This is similar to what we do for the non-institutional GQ population. Also, in our household population, about 12% of households are one-person households. So this is not really an unheard of method. Income is just some of what we collect for income, wages, self-employment, interest, Social Security, SSI, public assistance, retirement, any other sources. And importantly, this is income that's earned over the previous 12 months. So it very well may be income earned before the person was incarcerated. And then poverty status, we just compare the income to the individual poverty thresholds to get their poverty status for 2023. And we examine economic characteristics by imputed and synthetic status, as well as by type of facility, year, and demographics. That we all do in the paper that is hopefully coming out soon. It's not out yet, but should be coming very soon. I'll cover some of this in the talk, but we don't have time to go through all of it today. Just real briefly, I wanted to give an overview of a few of the results on poverty and median household income. So when we include the incarcerated in the poverty universe, as you see on the left side, poverty rates increase overall from 11.3% to 12%. And we see, I just put two subgroups, the Black non-Hispanic population and the American Indian and Alaska Native non-Hispanic population. We see much higher increases in poverty rates for those groups. Similarly, for a median household income, we see a decrease overall in median household income when we include the incarcerated in the universe, but we see significantly higher decreases for the Black non-Hispanic and the AIA and non-Hispanic population. The other thing I wanted to talk about and really give you some info about in this presentation is this imputed versus non-imputed. So that first column shows people that had no imputations, meaning that everything was reported. And you see that's about 33% of the population. And then there's next three columns are an imputation in some way, whether it's synthetic only, imputed income only, or both. And basically synthetic only means that their donor person had reported income. If it was both, the synthetic donor had imputed income. If you're more curious about that, I would recommend looking at our paper. So just to kind of briefly show you here, people who had imputed income had higher income, were more likely to have positive income and had lower poverty rates than people that had reported income. This is because it is a difficult group to impute for. And we see that this tells us that the incarcerated population may be even more disadvantaged than what our estimates show. And in the paper, we show this by type of facility. So you can look at like federal prisons, for instance, all by itself. Also, just so you know, just to show 2019, because of that change, I can just real quickly say that in 2019, 51% had no imputations, whereas in 2023, 67%. 51% had imputations, 2023, 67% did. But the pattern remains the same. There's higher income and lower poverty rates for the imputed population. And then here we just put in arrows for if an arrow pointing up means there was a significant increase, an arrow pointing down, there's a significant decrease. As I already mentioned, the population that with no imputed income decreased. The income decreased for the imputed income, it increased for reported income. It increased or decreased across the board for people with positive income, and it increased. Poverty rate increased for people with imputed income, but didn't change for people with with reported income. All right, some takeaways. If we exclude the incarcerated from the official estimates of income and poverty, it's going to affect our understanding of poverty gaps, both by sex and by race. I go into that more in the paper. We have some questions about the quality of the data, partially due to the difficulty of imputing for this group. And also, we have some questions about the quality and accuracy of the reported income for people in the incarcerated population. So our next steps are going to be a deeper dive into ACS edits to look at these imputation procedures. And then to leverage merged administrative and survey data so we can better understand the quality of ACS income data for this population. So there's my contact information, and thank you for your attention.
Thanks, Brian. So our last presentation for today's session will be a joint presentation with Diana Levery with ESRI, along with her colleague, Alberto Nieto.
Yes, thank you so much. Our lightning talk is about assessing attribute uncertainty in hotspot analysis, and we want to acknowledge our co-author, Catherine McSorley here. All right, we're going to go over what is hotspot analysis really quickly, and then what is attribute uncertainty. I'm going to pass it over to Alberto to do a demo, and then we'll wrap things up. So hotspot analysis is a spatial stats analysis where the null hypothesis is that something, could be something like poverty, some phenomenon out there is distributed randomly across geography, no spatial pattern whatsoever. And then the hotspot tool will use z-scores to determine whether or not to reject that null hypothesis. You could do this track by track, block group by block group, whatever the case may be. This is like the one audience that we present to where we don't really have to dwell on margins of error. But essentially all these measures or values of poverty have a range to them. There's a lower bound and an upper bound and a distribution within that range. So if we run something like hotspot analysis, how certain are these results? Because if we run it with the lower bound versus the upper bound versus that midpoint estimate, we can get very different results. So now I'm going to pass things over to Alberto.
Great, thank you. Okay. So I'm going to use an example of a map of poverty in California to show this new tool. In order to try to find a remediation strategy for poverty, often people run a hotspot analysis to find concentrated areas of poverty. So here's one such example. We took that ACS variable and we ran it with the hotspot analysis tool. But as Diana mentioned, often people ignore the margins of error variables that are included with that data. So in this example, for example, the location that I've selected here has 9 people below poverty level, but the margin of error for that location can be quite high compared to the original value. And very often people simply ignore the margin of error. So what we're going to do here with this new tool is actually incorporate that into the analysis. This is the tool, and I'll pass it the result of the hotspot analysis as an input. And then I can specify the uncertainty type in terms of either the margin of error, upper and lower confidence bound fields that you might have in the data, or a hard-coded % above or below. I'm going to keep it with margin of error because I do have the margin of error for this variable. And I'm going to let the tool run. And while the tool runs, essentially what's happening is it's simulating versions of the data subject to that margin of error, repeating the analysis. And at the end, it tabulates the results and labels locations that were fairly unstable compared to the original analysis. So here's the result. We have, once again, the view of the hotspot analysis, but overlaid on top, we have a hatching that represents locations that are deemed less stable with respect to being a hotspot, or whatever classification the tool gave it. And to interrogate further, you can click a location and see some diagnostics. So for example, here in the core of LA, if I click one of these locations that were deemed stable, the chart shows us that the original category was a hotspot with 99% confidence. And across 30 simulations within the margin of error, it consistently landed at hotspot of 99%. But if I select this other location, another hotspot region, much less stable across 30 simulations, we see that actually most of the results landed not significant, not being able to reject that null hypothesis of spatial randomness, even though the original category, just looking at the estimate, was hotspot 90%. So the idea, once again, is to give more confidence behind some of these insights that people create with these hotspot analysis maps. And last thing I want to share is that it's not just for hotspot analysis. Other tools that produce outputs can be analyzed with attribute uncertainty in mind. This is a very quick example of an index looking at multidimensional poverty in a very rough way. But I can pass the result of this index tool, which is called Calculate Composite Index. I can pass it to the attribute uncertainty tool. And in that case, what it would give us is very similarly a classification of areas that might be less certain and land at different categories. So in this case, for example, this region, whoops, let me select the right pop-up. There we go. Originally, this location landed at class 4 in terms of multidimensional poverty, but across several simulations, including the margins of error for multiple variables, it most often actually landed at class 5. And that can help us identify areas that might have been otherwise ignored if we just include the original margin, original estimate. So now I'm going to hand it back to Diana to close us off.
All right. So you just got a taste there of the outputs of this tool. Basically, you get a new layer with that super cool pop-up that has almost like a report for each and every tract, as well as a chart. And we want to say that outputs here do not replace your original output from the analysis, but just provide further insight. And as mentioned, there's a whole bunch of spatial stats analyses that are supported by this Assess Attribute Uncertainty tool. We just showed you 2 of many right now. And there is a resources handout in the conference platform. I added it to the handouts tab, so you can check out additional blogs and videos and help documentation and many more resources. So thank you so much for your time and your interest. We'll pass things back to the moderator.
Thank you both for your presentations. And so now we have about 20 minutes for questions, and just want to thank all of our presenters for their phenomenal information they shared today in each of their presentations, and also for addressing questions that our audience has posted in the chat. I don't see any questions that have not been addressed yet in the chat, so audience, please keep the questions coming, and we can address them live since all of the presentations have been completed. But I just have a general question for our presenters. This was a lightning talk. We understand that you couldn't share everything, but I know I'm interested in knowing how I could learn more about what you shared today, in particular, next steps. Many of the next steps you all shared were very interesting. Some of you alluded to manuscripts that are under development. So if each of you could just take a few minutes just to share with the audience how to learn more, that would be great. Martha, you want to start?
Sure. So our report is it's basically a how-to guide for states, and it's like 200 pages long at the moment. It's in clearance at the CDC and hopefully will be published this year. But we have actually been sharing drafts with states. So if you're a state public health agency, and you can definitely contact me, and we can see what your interests are. But it should hopefully be published this year once it gets through clearance.
Thanks, Martha. Jill?
Yes, so you can find productivity and remote work research in the handouts. I put a link to our page on it, but also if you go to bls.gov and look for the subject productivity, there's a notice right now you can find, but it has a link to our paper that we published last year through 2022 data. So not the new data, but hopefully a paper will be coming by the end of the year, hopefully.
Thanks, Jill. Lindsay?
Thank you, Chantel. In chat, I will put a link to a recent Springer edition coming from the Econ Journal by Amanda Weinstein and affiliated. It speaks about quality of life in depth. At this point, it's only cross-sectional, but it's a really good baseline of where we go. And we've continued to develop this. And within probably the next year, we should see our own developments moving toward academic articles. But we do follow Amanda Weinstein, who is the director of research here at the Center on Rural Innovation. This is kind of the first go at it from a cross-sectional approach. And we've continued to make it not only over time, but we're also trying to work to make it annual estimations using imputation and synthetic methods as well. So this is a really good baseline if you're interested in that.
Thank you. Elham?
Thank you. So I included a handout to our published report in that handout section. And I've also just linked a state level blog that we wrote that analyzes state level TCES rates. And then on one of the questions I've answered, we've also made some of the data available publicly. So you can look at data at the county level, PUMA, and state level on Urban Institute's data catalog. And I've linked that in one of the Q&A. And then in terms of next steps, we're hoping that we can update this in the future. So this reflects circumstances in 2022. We'd like to do an additional year and then years after that. And then we also have an ongoing project with New York right now focused on analyzing costs and resources that are more specific to New York City.
That sounds really exciting. Thank you. Kelly Vet?
Yes, so specifically for the Puerto Rico low response score modeling, we don't have a public report just yet. We are hoping to work towards that, and we have a lot of interesting results that we were not able to share because of time. But I will put in the chat the link to the planning database documentation data. And in there, you will find information about our main source of data and also the national level low response score, which does have a few public information available. So,
Thanks, Kelly Vet. And John?
Yes, so the work I presented on today is under review for a manuscript at the moment. So hopefully that will be coming out soon. It will be the same title and list of authors as the presentation today that you can see in the agenda for today. And that is just one study out of a series of many that we're working on as part of this larger collaborative project between our groups at UNC and the US Census Bureau Enhancing Health Program. So we are planning to publish quite a few studies over the next 2 years to give us a broader understanding of social determinants of health using these combined data resources. So just be on the lookout for publications with the same kind of collection of authors of the presentation today.
Thank you. And Brian?
Hi. Yes, our paper is also in the final stages of review, hoping that it will come out in the next month or two. And with the similar to John, same title, same authors. We also see this as our first stage in a multi-stage process. We want to, as I mentioned at the end, we want to. We're starting to look at some administrative data, or starting to get access to administrative data, linked to the ECS, and doing some further analysis, research questions in development at this point.
Thanks, Brian. Diana and Alberto?
Yeah, I can chime in. Oh, go ahead, Diana.
No, you go.
I was going to briefly say our presentation was a little bit different. It's about software that we create and hope that others get a chance to use. So most of our resources you can find in our handout. And the prime one that I want to point you to is called esriurl.com/spatialstats. And I'll type that out in the chat.
Thank you. And so we do have a few questions that have not been answered. The first is, do you know how juvenile incarceration impacts poverty rates? I think this question is for Brian. It doesn't say who the question's directed to.
Okay, yeah, no, I'm sure that's for me. No, we have not looked at juvenile incarceration, partially because the typing that's kind of partially because people that are 15 and under or are excluded from the poverty universe. So I'm not sure how much we would be capturing with that, but it's something that we could look into because it does identify juvenile incarcerated in the ECS.
Thank you. And then next we have, what are the implications of a changed low response score? How is the low response score used for imputed data, and how much would the improved input change the output?
can you hear me? I'm sorry.
Yes.
Good. So the current low response score is not used for imputed data. It's mostly used for assisting the census operation in the field, just to get a sense of what population would need sort of special attention to get those self response rates that we want, which is higher. But we can definitely look into that and explore that option. We are doing a lot of good research here and are open to exploring different ideas. So thank you for that.
Thank you. And let's see, do you have any other questions? No, I'm not seeing any other questions. So I have a question, and I have a question for John regarding, I think your next steps you mentioned were to look at the North Carolina health data. And my question's in regards to considering healthcare status. So individuals who may have employee-sponsored health insurance versus those on public insurance, how that might impact your analyses, or if you or your team are looking into that.
Yes, we are looking into that. We don't have an analysis plan where that's sort of the outcome in itself, but we're looking at how those statuses impact models that we're doing to predict diabetes outcomes in type 2 diabetes populations more specifically. So we sort of chose that as a representative case sample within our patient population, and we're doing a lot more detailed work on that. So we're incorporating health insurance statuses into all of those models to see whether, how much those impact the A1C outcomes of these patients versus the broader SDOH variables.
Thank you. And I guess even for other chronic health conditions, are you considering those such as hypertension, obesity, or is your team solely focused on diabetes?
Yeah, we only chose diabetes as the chronic condition for the current set of analyses with the current grant.
Okay.
But on the other hand, we've sort of set up this data partnership that we have between UNC and the Census Bureau such that it can be an ongoing resource to new teams that have all the appropriate permissions to come in and propose new studies to work with it. So if we have investigators that are interested in pursuing similar questions to what we're doing, but on other chronic conditions, we're trying to create the infrastructure for them to do that in the future.
That's great. Thank you. So we do have a question for Jill. I'm interested in the interaction between remote work and transportation usage, such as a trip generation. Could you point out literature along those lines? I'm not seeing Jill anymore. So we'll table that when she's able to rejoin us. And Carl will work on getting your response to that question. And so, Ilham, for your analysis, have you, it seemed like what you presented today focused on individuals who are 65 years, well, younger than 65 years of age. Have you considered looking at older adults who are 65 and over?
Yeah, so with the brief presentation today, I only focused on one family type and then showed a couple of age groupings. But in our primary report, we focus on 3 different family types. So families with children and no older adults, families without children, and then families with older adults. So we can look at differences between each of those family types. In general, we see that still families with children have the highest TCS rates. So those families are the worst off. And families with older adults tend to have slightly lower TCS rates. And part of that is because of how we determine costs and resources for folks. So one of the things I mentioned is that we include a savings target as part of the cost category. But if you're over 65, we assume you're no longer saving and you're in a state of dissaving. So they don't have that added expense. And so that's in part why we see lower TCS rates for that older adult group.
Okay, thank you. Jill, are you back with us?
I did lose. It just shut down.
Oh, I hear you.
Camera's back, but yes.
Okay, we can hear
Can
you.
you hear me? Okay.
Yes, we can hear you. And I have a question for you. The question is,
Okay.
I'm interested in the interaction between remote work and transportation usage, such as trip generation. Could you point out literature along those lines?
Sorry, this might be a disappointing answer. I'm not familiar with literature that has the transportation usage with remote work, although we do a little bit of a literature review in our paper, but it is focused on just focused on remote work and productivity that like the Fed and others have done. I could look for some and maybe we'll add some to our upcoming paper if I find it.
Okay, thanks, Jill. And then for Lindsay, for your analysis, I was just curious if you've looked at, I know that you pulled different years of data for the analysis, but I'm just interested if you see any like temporal trends. So like during COVID, quite a few people were working, those who had jobs that allowed for them to work from home were able to do so. And even others relocated to maybe a place that might have been more desirable because their job allowed for them to do so. So I'm just curious as to, from, I guess, during that time period versus maybe 5 or 10 years prior, if you saw any difference with the quality of life measure or the outcomes from the quality of life measure based on how you and your organization are defining it.
Thank you so much, Chantel. Yeah, actually, I think that's a really wonderful point that you bring up, and it's something due to 7 minutes we had to cut. But we know that there's a rise in remote work. Since 2010, we have started to see remote work creep up. But of course, 2019, 2020, we saw nearly 20% of the nation had engaged in some form of remote work. And even though that's gone down, right, it's projected to kind of tick back up over the next couple of years. Absolutely. And in fact, in 2020 and 2021, there was a article that came out from the Atlantic that said that small towns are starting to engage more to attract residents and private citizens over firms and franchises. And the reason why they were doing that is so that they can quite literally, right, attract residents, bring in more revenue, specifically toward remote workers. And in order to do this, they were actually increasing and developing specifically quality of life indicators. For instance, they were developing their waterfronts. Areas in Vermont were trying to really establish their hiking and mountain trails. They were developing cultural nightlife in main streets and downtowns. And so this is really important. And in fact, when we were working for an annual estimation, we utilized the housing price index, and we were able to see that fluctuating trend over time. And so within 2020, we see a drop in quality of life for everywhere, but nonetheless, we see actually small towns start to really beautify themselves in a way where quite literally, right, the quality of life trend, although in opposite to national trends, started to increase and be bolstered. So yeah, absolutely. Especially with remote work, we're starting to see that in rural towns specifically. Individuals are leaving metropolitan areas so that they can go somewhere with a higher quality of life and hopefully, right, a lower cost of living. So I think it's pretty positive all around. In fact, if you're interested in that, we're currently working on it, but I was just responding to Carl Davison, who asked me about literature. Carruthers and Mulligan 2006 is a really wonderful piece to get started with. I'll message that in the answer. But moving from there, essentially we're the first to start moving this in a contextually driven manner that starts to include some of those distinctive contextual characteristics. So I think it's a really valuable measure that, in all honesty, right, econometrics really kind of loses focus on. But yeah, thank you so much, Chantel.
And it looks like there's been a question posted to you, Lindsay, in the chat.
From Carl?
From Brandel Temple. Can I also get an alert for quality of life values by county, and they
Yes.
included their email address for you.
Absolutely. Thank you so much, guys. And on that note, I will put you into an alert. By the way, our GitHub repository, I've put that in our chat. It is publicly available. Our quality of life data is not yet available. However, I will send you a link. If you follow Weinstein et al. 2023, you can recreate the quality of life measure yourself. It's just pretty intensive because it does pull from multiple sources, aggregates, and then moves forward. But I will certainly do so.
And that concludes our time for today's session, everyone. I just really want to thank each of our presenters for the phenomenal presentations they gave today, for our audience for hanging in there with us this afternoon. And please hang around. There'll be a short break, but at 4 o'clock, there'll be another series of sessions followed by the closeout for today's virtual conference. So thank you all again for joining us. And please keep in touch with our presenters. They've included their contact information and review the handouts that were also shared. Have a wonderful rest of your day.